Good afternoon. I'm Stanley Brown. I'm the Dean of the Dalla Lana School of Public Health. Let me start with the acknowledgement. We wish to acknowledge the land on which the University of Toronto operates. For thousands of years, it has been the traditional land of the Huron-Wendat, the Seneca, and the Mississaugas of the Credit. Today, this meeting place is still the home to many Indigenous peoples from across Turtle Island. We're grateful to have the opportunity to work on this land. Welcome, everyone, to a special Dalla Lana School of Public Health event, Policed to Death, a panel discussion of the public health threat of over-policing in Black communities. This afternoon's discussion is an important one. Based on a first-of-its-kind course offered by the Dalla Lana School entitled Anti-Black Racism as a Policing and Public Health Crisis. In this talk, we will learn from research, as well as from lived experience of our panelists, about the often overlooked impacts of systemic racism and policing on the health outcomes of Black communities in Canada. At the Dalla Lana, we're not afraid of having bold, and some people, uncomfortable conversations. In fact, in many ways, these conversations and discussions are long overdue. Part of our commitment to anti-racism means holding public discussions like these that aim to spark a dialogue on critical issues and engage our community and the public in addressing and championing solutions to these pressing issues. Today's discussion, I'm happy to say, will be moderated by one of our own, Dalla Lana alumnus, Paulisha DeGans. Paulisha holds a Master of Public Health and currently works as a Senior Policy Advisor at Addictions and Mental Health Ontario, where she leads equity, anti-racism, anti-oppression, diversity, and inclusion initiatives across the entire addiction and mental health sector. And my deepest thanks go out to our panelists this evening, Professor Akwatu Khenti, Professor Dexter Voisin, and Liben Gebremickael for sharing their experience, their expertise, and the solutions that each of us, as individuals, groups, and institutions, can contribute and participate in. Now, without further delay, I'm going to turn things over to Paulisha, who will introduce us to our panelists and get us started. Thank you, Paulisha.
Wonderful. Hi, everyone. Thank you for being here. My name is Paulisha DeGans, and thank you, Staney, for the introduction. As Dean Staney mentioned, we are here today to discuss the important issue of over-policing in Black communities as a public health threat, a topic myself and all the folks here are very passionate about. Before we get started, I'm just going to go over a few housekeeping items. This session will be recorded with closed captions, and the recording will be made available on the DLSPH YouTube page after the event. We'll be taking questions from the audience toward the end of the event, so please use the Q&A function throughout the event to ask the panelists thoughtful questions, and some will be selected to be answered live during the Q&A portion. Without further ado, I would like to introduce our three fantastic panelists for this evening, Dr. Akwatu Khenti, Liben Gebremickael, and Dr. Dexter Voisin. So Dr. Akwatu Khenti currently serves as the Director of Transformative Global Health at the Center for Addiction and Mental Health, also known as CAMH, and as an assistant professor with the Dalla Lana School of Public Health. He is involved in a wide variety of international efforts to strengthen mental health and addiction in primary care. He previously led CAMH's development of a cutting-edge training center, the Eli Lilly Canada Learning Center, and its specialized drug program and prevention program for Black youth in Toronto, the substance abuse program for African and Caribbean youth. Dr. Khenti is a principal investigator on several important research initiatives, including a randomized control trial to test an anti-stigma intervention in primary health care in Ontario. He's also led the development of an easy-to-follow, culturally adapted cognitive behavioral therapy interventions for immigrants of Latin American as well as African Caribbean origin. His current research also includes Black homicide victimization in Toronto and issues related to gun violence. Next, I'm going to introduce Mr. Liben Gebremickael. Mr. Liben Gebremickael is the first executive director of TAIBU Community Health Center. TAIBU Community Health Center is at the forefront of the delivery of community health and social services to Black communities across the Greater Toronto Area. They aim to improve, promote, and protect the health and well-being for Black populations through quality healthcare and culturally designed primary healthcare services and strategies. Liben has over 25 years of experience in the primary healthcare sector, social services, mental health, and community capacity building and development field. He has worked as a social worker, child and family therapist, and therapeutic group facilitator. And then lastly, I'm going to introduce Dr. Dexter Voisin. Dexter Voisin is the current Dean of the Jack, Joseph, and Morton Mandel Dean in Applied Social Sciences at Case Western Reserve University. He began his tenure at the Mandel School in January 2022, after serving for 2.5 years as a Dean of the Factor in Wintosh Faculty of Social Work and the Sandra Rotman Endowed Chair in Social Work at the University of Toronto. Before this appointment, he was the professor at the School of Social Service Administration at the University of Chicago for 2 decades, as well as faculty affiliate at the Center for the Study of Race, Culture, and Politics and the Center for Health and Social Sciences. His research examines how structural, racial violence, and interpersonal forms of violence impacts health behaviors and outcomes among minority populations. His expertise and research findings have been frequently cited by numerous members of the international and national media, including Al Jazeera, the Associated Press, BBC World News Radio, the Canadian Press, and CNN. Voisin has been 30 years of clinical experience with practice expertise in the areas of substance abuse, adult psychopathology, and adolescent and family therapy. So thank you everyone for being here. So I'm going to start us off with the moderated discussion with a question for Dr. Khenti. Akwatu, to start off, can you give us an idea of the scope and of the issue of over-policing Black communities in Canada? As Canadians, we often think of over-policing as a uniquely American issue. What exactly is racialized policing, and what is its history in Canada?
Well, thank you so much, Felicia. That's a very multifaceted question. And it's a privilege for me to be here. So thank you so much. The scope of over-policing in Canada, particularly in Toronto, can be gleaned from patterns of drug arrests related to illicit drugs, where you have similar prevalence between Black and white youth or Black and white adults, but where we see very different responses from police. And whether it's Vancouver, Calgary, Regina, Ottawa, Halifax, various studies have found that Blacks are disproportionately arrested at greater rates than prevalence would indicate. And Akwatu Owusu-Bempah did a study of that. And he recently did a follow-up with Vice News for the period from 2015 to 2021. 2015 to 2021, they looked at 5 cities, Toronto, Ottawa, Saskatoon, Regina, and Vancouver, and found racial disparities in arrests right across the country. Just to give you 2 examples, here in Toronto, Blacks were 4 times more likely to than the population would suggest to be arrested for cannabis and other drugs. Whites in Ottawa 3 times, sometime in 2021, 4 times the rate of the population. Another way of saying that, Blacks are 9% of the population, 1/3 of the cannabis arrests. So a huge and a significant disparity, which is actually comparable to drug arrest patterns in the United States. If you look at driving whilst Black, walking whilst Black, just being Black, street checks. Various studies have shown Montreal, 3 researchers in 2019 did a study, 4 to 5 times more likely to be stopped if you're Black than if you're white. Actually, the most stopped group were Indigenous women, 11 times more likely to be stopped than any other group. Toronto the same, Halifax the same. In Halifax, 6 times more likely to be street checked than if you're white. Same across age groups. Driving while Black, walking while Black, using cannabis, street checks, patterns hold right across the country. And these patterns are reflected in the incarceration rates, which really ultimately is where the over-policing shows up. And here in Ontario, Black males, 1 out of every 15 Black males has been incarcerated. 1 out of every 15 Black males has been incarcerated compared to 1 out of every 70 white males. So, I mean, this is a ridiculous disparity to my mind, but it shows you the scope of the problem. Again, very comparable to municipalities in the US.
Thank you for sharing that. And it's very clear that there's evidence to support over-policing here in Canada across the various studies and cities that you mentioned. So why isn't this as prominent of a discussion as it is in the United States?
Well, a couple of reasons. 1, we don't keep race-based data. consistently across the board. And even if we keep race-based data as we do in Ontario, we make it very difficult to access that race-based data. You know, you have to file a freedom of information request, and it will take you years to get it. And usually the researcher has to be institution-based in order to sort of stay the course, to have the stamina for the course. That's number one. Number two, Statistics Canada, which reports on race-related issues in policing, only reports on it if there's a charge of the police. And you know that's very unlikely to happen. And when it happens, even if it's discharged, so the statistics tend to be very conservative. And the third point, I think, is a positive stigma. You know, we usually think of negative stigma, negative public stigma, but we have historically based positive stigma. That's to say that we expect otherwise. We think as Canadians, we treat Black people better than Americans. And there's a book written by Clayton Moshe, which talks about the treatment of Blacks in the courts from 1921. And one of the features of that book is how police and judges tell the Blacks, you know, if you were in the States, you know, they'd be kicking your ass, but over here, we're treating you lightly, even though there was racial disparity in how they were being treated. And this idea goes back well into the mid-19th century, and I think is key. Positive stigma. That's not how we do things in British North America. It's not how we do things in Canada, despite abundant evidence to the contrary, because in Canada, up until around 1960, racism was legal. Discrimination was legal. And the role of police was to support segregation where it was sustained in transport, hotels, theaters. And you know, we have a famous woman, a Black woman on a $10 bill. Her name is Viola Desmond. And Viola Desmond was arrested by the police for going to a theater where Blacks were segregated. They weren't allowed to sit in a particular section in 1954. And that was an experience of racial policing that doesn't necessarily fit with the definition as we know it. So I sort of went off track there, but I hope I answered the question. What was the third part, Polisha? It looks like you're frozen on my screen.
Sorry, Polisha seems to be frozen. I can step in for her.
Yeah, I think she asked me to define racialized policing.
Yeah, exactly, and why it's not as big of a conversation in Canada as it is in the United States.
Yeah, so two points. Racialized policing, according to the Ontario Human Rights Commission, and I used their definition specifically, and then add a bit of mine, actions undertaken for reasons of safety, security, or public protection that relies on stereotype about race, color, ethnicity, religion, or place of origin, rather than on reasonable suspicion to single out an individual for greater scrutiny or treatment. So, you know, simply put, police actions that rely upon stereotypes rather than reasonable suspicion would be the way I would see it. But there's another aspect of racialized policing apart from the suspicion. It's really to maintain space, to keep you in your place. You know, I'm saying this like in the Caribbean way, keeping you in your place, because when Viola Desmond went to that theater, or a guy named Clayton Fisher went to a restaurant in Montreal, took his case all the way to the Supreme Court and lost, it was the policing that they experienced wasn't because they were suspected of being criminals. Rather, it was because they were exercising what they thought was their human right to be able to access public facilities as taxpayers. But they found out that, you know, the law didn't support them in that particular way. So there's this sort of two aspects of policing. The policing that, you know, you expect, you know, looking for people who are breaking the law, but policing related to being a Black human being.
Wonderful, thank you for that. And thanks for stepping in. Apologies, working in a virtual environment. Of course, when we do the tech check, everything works. And of course, when you are live, things go wrong, but that's okay. Thanks for folks continuing the conversation. I know there's lots of resources that are out there. We also know that there is a book if folks were interested in reading from one of our panelists, Dr. Dexter Voisin, also titled America the Beautiful and the Violent, Black Youth and Neighborhood Trauma in Chicago, if folks wanted to do further reading as well on this subject. But Akwatu, we also know there's lots of opportunity for folks who are at Dalla to learn through taking your course. So tell us more about your course, Anti-Black Racism as a Policing and Public Health Crisis, and the impetus for developing this new course.
Thank you. You know, so the rationale or reason or impetus for the course really came out of the establishment in Ontario of race-based data standards in 2017, where education, criminal justice, and child welfare sectors over the subsequent 5 years were supposed to be collecting race-based data. And police boards at the beginning of 2020 were supposed to be collecting race-based data on the use of force. And so it's been almost 3 years now. It's supposed to be 3 years of data in there. But the system is researcher dependent. You know, researchers want to access the data, and the ministry then is supposed to set up a partnership agreement with the institution or the researcher to analyze whatever data has been generated. And that was one impetus, and myself and colleagues at Dalla have been trying for the past 2 years to access that race-based data in policing unsuccessfully, but we continue to struggle. So that's number one. But we wanted to prepare students who could work with that data as well as the issues related to that data, who could analyze disproportionalities and be able to determine if a disproportionality or a trend was a disparity or an inequity, which an inequity by definition, something that is preventable. That's number one. We wanted people who could do that analysis, who could bring to the analysis root causes of socioeconomic instability of Black communities, which brings them into greater contact with the police to their negative consequences. We also thought that we needed public health practitioners who could interrogate a lot of assumptions that have gone into policing, militarized assumptions, which actually relate to the war on drugs. Another topic of that's related to our public health arena, the use of illicit drugs and substances, as well as the practices around that war on drugs, mandatory minimums, no knock search warrants, which are disproportionately used in drug arrests, which disproportionately impact Black families as well as the individuals who are targeted. So you have a huge amount of people breaking into people's apartments and searching for this guy who's supposed to be selling drugs, but leaving behind significant physiological and mental health consequences where Black people families are left to fend for themselves. So militarized assumptions that lead to significant physiological and mental health consequences. Being able to understand the role of decriminalization of substance use, decriminalization of certain patterns of behavior like loitering, minor traffic violations, as well as the system that sustains it. The role of white supremacy. Why is whiteness privileged and Blackness made it into a risk factor in terms of one interactions with police and the criminal justice system? The need to understand and end racial profiling, as well as the variations that emerge. And of course, the need actually to be able to assess harms so that we can develop interventions to address the wide-ranging harms, which actually range from mental health issues such as PTSD, depression. We have a huge depression burden in Black communities across this country. Something like 66% of people report severe depression. And some of that severe depression comes from racial discrimination at the hands of police across the chronic conditions. Over-policing engenders chronic conditions. It fuels higher rates of diabetes, higher rates of heart disease, high blood pressure. And so it's not just one condition, it's many conditions. Thus it is, that's what really makes it a public health issue. And finally, I would add, it diminishes the empowerment and participation of a specific population, which isn't a public good, but a public bad, if I could use that term.
Thank you for all of that. You also mentioned higher rates of mental distress among Black communities, and some of that being attributed directly to experiences with the police. I would be interested in hearing more about the mental health effects on Black communities generally, as seeing this in the news, etc. But we'll save some space for that a little bit later and give you some time to drink some water, Akwatu. You've been giving us some great background information. So for the next question, also started with Dexter. Tell us about the current data available in the landscape. From what evidence you have seen and that you have researched, how prevalent is the issue of over-policing in Black communities?
Well, I think, in terms of the data, Akwatu did a wonderful job in terms of laying out the data. Part of the context that's important to understand, I've lived both in Canada and in the US, so I'm doing a sort of comparative lens. In many major Canadian cities, there is a veneer of inclusivity, particularly when you look in the media and you see a lot of racial representation in the media. And I can tell you, when George Floyd was murdered in Minneapolis, I did many interviews with the Canadian media. And after the cameras turned off, many of those reporters said to me privately that, we are represented in the media, but when it comes to folks in upper management, there's no one that looks like us. It's basically controlled by white males. So I think within the Canadian context, Canadians by far, I may get pushed down for this, are very warm and welcoming as a society. But what lies beneath, when you scratch beneath the surface, it's many of the same structural inequality issues we have in the United States. And I think it's important to keep in mind that Canada, as well as the US, are both born from settler colonial ideology. So we're still drinking from the same water in terms of a white lens and a white supremacy gaze. Whether you're in Canada or in Toronto, it's pretty much the same when you look beneath the surface. So Akwatu talked about the disproportionate rate of Black individuals in the prison system. And in part, what makes this possible is the fact that in a city like Toronto, you have the same racial segregation index for housing in Toronto, similar to Minneapolis, Minnesota, where Mr. George Floyd was murdered. So when you strip the veneer aside in terms of Toronto being a majority minority city, and you look at Black housing, it's still very much racialized and segregated. And because of that, it allows many of these segregated communities to be over-policed, because you basically have a higher concentration of Blacks, and particularly low-income Blacks, in certain areas, which allows for greater scrutiny, greater policing, and greater arrests. So you look at the structure in terms of housing, you look at the structure in terms of policing, and keep in mind, part of the ideology is that poor individuals are dangerous. And then if you're poor and Black, you're also dangerous. And if you're poor, Black, and male, then that's another notch added to your sort of danger quota in terms of how Black bodies are seen and policed. So I think it's important to understand the structures and the policies that lead to these different types of inequalities. I think it's also important to understand what we call toxic stress. And we know as individuals that in the presence of danger, you either freeze, fight, or flight, right? And that's sort of a general human response to threat. Individuals, we are not made to function at a high rate in terms of the flight response. That takes a toll not only on your limbic system, on your whole immune system, your whole mental health, but we are not meant to operate at these levels for an extended period of time. white Canadians have a very different experience and perception of police vis-a-vis Black Canadians. And in many ways, we talk about my book, America the Beautiful, but it could also be easily turned Canada, the beautiful and violent, right? That basically you have individuals navigating very different realities in Canada based on your racial identification, particularly in terms of your degree of Blackness. So when individuals see police or are interacting with police, that fight syndrome is very much in operation. And keep in mind, when folks are in either fight or flight mode, all right, they may not be thinking correctly. And then you have police who are approaching individuals already with the stereotype of threat. It really sets up a very combustible, dangerous situation, because someone who may be hyper vigilant or hyper aroused may make a sudden movement, and that may be perceived by the police as a threat or drawing a weapon. So it creates a very combustible situation when you look at the intersection of race, gender, class, as well as location. So mental health, it's Black individuals on average have higher rates of cancer, have higher rates of diabetes, and you have a lot of social scientists that are saying that many of these higher disease burden is not only attributed to lifestyle issues, but the impact of toxic stress on the body over an extended period of time. Higher rates of cancer, right? Higher rates of diabetes, higher rates of every imaginable illness under the sun. It's a higher burden borne by Blacks. And not just because, again, of lack of access to services and healthcare, but also this notion of toxic stress, the stress that lies beneath the skin, that gets under the skin on a daily basis when someone leaves their home and they have to start thinking, how do I present myself in the world so that I'm not seen as threatening, I'm not seen as dangerous? That extra burden that someone carries on a daily basis because of their racial identity and how they are perceived by others because of that racial identity.
Wonderful. I have a follow-up question. Dexter, you mentioned how there is evidence of racial segregation where there's higher concentrations of Black communities in certain areas, and how this can enable there to be over-policing in these certain neighborhoods. For Black individuals who don't live in a predominantly racialized or predominantly Black neighborhood, what is their experiences with the police? If you would like to respond, or other folks can jump in. For folks who are Black and maybe
well, you know,
what are their experiences?
Even if you're middle class or upper class and you're living in a very integrated community, you do not escape police scrutiny. So we know from studies that even individuals who've gone out to the suburbs or in other areas, they're also perceived very differently than their non-racialized neighbors. And particularly when we look at Black individuals, and we're talking about a particular type of racism here, right, which we call anti-Black racism. All white groups experience some form of exclusionary responses based on not being deemed white. But Black individuals in particular, when you look at the history of Blackness in Canada and how Black bodies are viewed universally around the world, it's a particular type of weight that comes with that burden. And that's why when we had the George Floyd, it was a global outcry, because Black folks from across the diaspora were talking about, and identifying with that experience of policing, right? So even if you're white, Black, and middle class, you have a very different experience than your middle class or upper middle class residents living in that same community.
Wonderful, thank you for that. Liben, did you have anything that you would like to add to either of the last two questions? Just what is the data that is out there, and what are the experiences for folks with the police?
Thank you for the conversation. I just wanted to add, what Dexter was saying earlier on about this toxic stress, but it's also, I think, as people are, we take the example of what has happened in Buffalo recently, and the impact that would have on the Black communities and how that is processed, right? It's another exposure to a trauma that adds to our own kind of struggle and experiences that we have, and seeing that, and that's what, it reminded me why it was so much difficult when we were exposed to what happened to George Floyd, was that was, taken as our own personal trauma that we had to go through. And in addition to the daily kind of stress that we go through, whether it's going to work, and, I know Akwatu was mentioning about, driving while Black, and then going to work, and then you have working while Black. And then you are exposed to such a very, violent kind of an exposure that also adds to trauma, and then builds on how your existence means to you in a situation like this. So that also adds to mental health stress, physical stress. And we know when the George Floyd incident happened, it was also within a pandemic, when we also know that the pandemic's impact was disproportionate, still is disproportionate. And so you combine all those that has gone on for generations, it's very difficult to even contemplate. It can be very overwhelming, even talking about it. So, that's what I just wanted to add to the conversation, what Dexter was saying earlier.
Thank you. Akwatu, I see your hand up.
Yeah, I just want to add one point, and it's a point that has been made by those scholars who studied street checks in Halifax, Kingston, Montreal, and Toronto. And that was that communities that are racialized, that have larger proportions of Black people, are over-policed. There's a greater police presence, more interdiction or street checking, quote unquote. But so that's in those communities. But ironically, Black individuals who live in those communities, racialized communities, have less probability of being street checked than when they live in a white community, or a more affluent community, or a more educated community. What's unique for Blacks is that affluence, housing, education, and job is not the protective factor that it is for not just for whites, but for other ethnic groups. For Blacks, if you live in those communities, you're actually more likely to be street checked than if you live in a more racialized community, because of, you stand out, and thus it is, and especially Black males, less so for Black females, especially so for Black males. So there's a race intersectionality, gender intersectionality, size intersectionality, and of course, complexion intersectionality. If you're dark-skinned Black with an African phenotype, you are the receiving end of some of the most vociferous stigma. So it's also complexion oriented and phenotypically oriented. That's how complex it is right across the Americas, I would add.
Yeah, I want to jump in and underscore something Akwatu just talked about. So I think, if you look at relatively homogeneous communities, and you look at a largely homogeneous poor Black community relative to a poor white community, you would expect and see higher rates of policing and surveillance, right? Poor people in general tend to be viewed in most societies as more suspicious and less deserving. Let's just be clear about that. But if you're poor and white versus poor and Black, you have a very different experience. And what Akwatu was talking about in terms of your question, Felicia, in terms of looking at the intersection of class, if you are middle class or upper middle class Black and you're living in a very heterogeneous community, you're still also police. And it goes back to the notion of what Akwatu talked about. The function of policing was basically to keep people in their spaces, So when you find folks being sort of deemed as being out of place, right, you experience more policing, because policing by nature was designed, particularly as it relates to racialized populations, Black and Indigenous populations, was to keep them in their space. And the counter narrative of that is to keep white folks safe, right? Because Black people and Indigenous people were dangerous, so they had to be kept into their spaces. So very often you talk about people living on the other side of the train tracks. Every city has this sort of invisible dividing line, right? And that's present across Canada as it is in the United States.
Did you want to add something, Dexter?
No, I was watching Liben and he was looking like he was thinking. So I was wondering if there was something going through his mind that he wanted to share.
Liben, did you want to jump in and respond?
Sorry. No, I was just, visualizing what was happening and seeing it, in the work that we do in the community, and you see that, right? So nothing to add, but just, you created a vision in my head, Dexter. So thank you.
Wonderful, thank you. I know all of the panelists have mentioned the connections and the correlations with mental health and the policing, and I wonder if folks could delve a little more deeply into that connection and the correlation and the poor effects of it. So I'll leave it open for if anyone wants to jump in first.
So let me start us off, since my background is in mental health. So, if you look at use of DSM, classical criteria for mental health, mental illness, similar rates of prevalence for key diseases. If you look at a Black country, compare a country like Barbados or St. Lucia or even Jamaica with Canada or the UK, similar rates of schizophrenia for one, similar rates of depression. But when people migrate to these places and become a Black minority, that's when their situation changes and their prevalence rate rises significantly, not just for mental health problems, but also for chronic conditions. Now in the Caribbean, we have certain chronic conditions related to slavery, higher rates of diabetes especially. But when we compare all of the chronic conditions with our progenitors in Africa, we find that their prevalence rate is significantly lower on all of the conditions. So it's not genetic. What it is all environmental or social determinants of health related in the society. And so whether it's depression, mood and anxiety disorders, and there's a lot of mood and anxiety disorders related to the Black experience. And the funny thing about the Black experience is anxieties, for instance, you experience discrimination, it makes you more susceptible and raises your expectation of more discrimination, raises your anxiety levels, and we have anxiety levels at a norm that is higher than the white norm. And it's because of this quote unquote Black experience, which forces one to have a double consciousness, because you know that what you're experiencing is not the same as what your peers are experiencing, especially in your interactions with security officials, whether it's customs, police, security guards in the mall. There's, and that I think is the source of that stress that Dexter talked about. We carry a heavier burden. It's called the biological concept of weathering, which leads to premature aging. And even though, people like myself look good, that stress and distress is in our bodies. And thus it is that our mortality rates or life expectancy is lower and the mortality rates are higher because of those very same chronic conditions. So when an epidemic comes along like COVID, we just fall by the wayside because we have so many vulnerabilities that aren't biological vulnerabilities, but it appears so because, you get severe COVID. Why? Well, it's because you're living in a society that undermines your health culturally and systematically, because your physical features is a risk factor. Not only is it a risk factor in your interactions with non-Blacks, it's a risk factor in your self-assessment. So that when you look in the mirror, you feel ugly if you have an African phenotype because of the norms of the society. And as a result, you are more vulnerable to using carcinogenic skin cream lighteners, or you spend more resources on your hair than you have because you just don't feel right unless the hair is right. And the hair can be right because it's African hair and it's frizzy or it's nappy or what have you, and you want it to be, to be able to swing it, like swing your hair, and so we have more of the same mental health conditions like mood and anxiety disorders. But then on top of that, because of the Black experience, we have something that Naeem Akbar, a US psychologist, called anti-self disorder. Anti-self disorder, which in the world of mental health could be self-stigmatizing attitudes and self-stigmatizing behaviors, where people act down and take themselves down through the belief that this is how they're supposed to be anyway. So that in aspiring to be positive, that's not for them. And from the cradle to the grave, we have an abundance of conduct disorders right through to late stage dementia that actually expresses itself in racial terms.
So let me pick up where Akwatu left off and illuminate a few of those points and a couple others. So, you know, in this conversation, we're talking about when racism gets under the skin, or when racial trauma gets under the skin, and the different mechanisms in which that takes place. And again, I think if we could entertain the notion that when you look at societies across North America, particularly Canadian society and American society, white norming is the standard, right? So to the extent that you approximate whiteness in terms of your physical presentation, and to the extent that you replicate white culture, and folks would arguably say, what is white culture? But, you know, there's a sort of shared understanding around that you have more advantages in society, right? And there's this notion that white individuals at the top of the totem pole in terms of the caste system. And you have individuals who would seek to approximate that through, you know, presentation, skin bleaching, the hair accessories, and so on, because there's this notion and a real belief system that you have more privileges to the extent that you approximate whiteness. When we look at the concept of toxic stress and how it gets under the skin, there are individuals who, rightfully so, recognize that individuals that look like them have a different experience with the police, but not just with the police, with other formal systems, even in terms of interaction with healthcare systems, and where bias and stigma shows up in healthcare systems, and individuals who would not seek medical care and would self-diagnose or do homeopathic responses and wait until the very last moment before they go in for formal healthcare, because of this notion that the system is stacked against them, right? So when Black males do go in for treatment for prostate cancer, very often it's at a higher level of chronicity, right? It's in a more terminal phase. Or when Black males in particular go in for healthcare, they're very often at stages that are untreatable when it comes to chronic disease, right? So the whole notion of fear and mistrust of healthcare systems, police systems, court systems, and really staying away from these systems. I think the also notion too around self-defeating behaviors. And not only that, but the way that folks medicate trauma and medicate distress by using alcohol and other substances, right? So there are a lot of individuals who are walking wounded, who would not seek help either because of cultural stigma or because of a mistrust of formal healthcare systems. Akwatu, you brought up the notion of anxiety. It's really interesting. We did a study of young Black males, And we found that young Black males who were exposed to neighborhood violence and police violence, their rates of depression were extremely low. However, when we looked at their rates of anxiety, it went through the roof. And what that told us is that young Black males were less likely to report depressive symptoms, but because it was not seen as culturally acceptable to say, I'm a young Black male and I'm depressed, right? And for a whole host of reasons. If you start doing that and saying that in the streets, you lose street credibility, it also puts you at risk for other types of targets. But they were more willing to report anxiety symptoms, right? That was culturally seen as more appropriate to report anxiety symptoms. So we have a lot of folks who are in school systems who are walking around with clinical anxiety and clinical depression that is not being treated and is being misdiagnosed by teachers, by social workers, by healthcare providers as something else, something that tends to be a lot more negative and nefarious. And again, this is where trauma and racism literally gets under the skin in terms of impacting health, mental health. And again, we know that there's a strong connection between mental health and physical health, that these systems are very much interconnected, as well as spiritual health, right? So again, the unrecognized, unaccessed burden of walking around while Black and the additional stress that it takes on the body, the mind, and as someone says, lacerations to the soul, cannot be understated.
Thank you for that. The physical effects and of police brutality is very apparent to us all, but Liben, from the community perspective, what are you hearing from the community about how racism, interactions with the police, how is that all impacting folks' mental and physical well-being?
I mean, it's what the research is telling us, just like it has been described in our previous conversations. One of the things I really wanted to bring about is the impact of police interaction during. I mean, we've talked about how police brutality, anti-Black racism, systemic racism, and all that is impacting on the health and well-being of Black communities. But also when people are, experiencing difficulties, such as a mental health crisis or any kind of a situational, family situation or neighborhood situation, and they require some support, and it's police that is responding to that support, we know how that has been, impactful, right? I think the experience of and the unfortunate death of Regis Korchinski-Paquette is the example that the example for this interaction between police and mental health and how that should be dealt with. And so, following this experience, following the George Floyd incidents and the COVID impact of the COVID pandemic, there has been conversation, and the city has been doing a lot of consultation to try to have an alternative response to community crisis that does not involve the police, at least at the forefront. And we, at TAIBU as a community health center, we've been part of this initiative. We are the anchor and leading agency here in Scarborough. There are about 4 pilots being implemented in the city, 1 in the Northwest, 1 downtown, 1 specific for Indigenous population, and 1 in Scarborough. And TAIBU is the organization that is leading the implementation of this pilot in Scarborough. And this is to kind of remove police from responding to things that they were not meant or are not equipped, and particularly knowing that there's already a challenged relationship between community and police that could and would, has exacerbated when police are responding to a crisis situation. When people are in distress, already seeing uniforms, weapons can elevate the crisis rather than de-escalate it. And so we're part of this new initiative where we have now a community response team that has been that is being deployed when crisis calls are made. It's just the beginning. It's been about 5 weeks now since we've started this, but you know, this is you know, like when somebody has a heart attack or another health situation, police does not respond to a health crisis. It's qualified clinical or qualified people that respond, and it should be the same when communities, particularly racialized communities, are going through a crisis. And so moving the services or responses from institutions, from police to community-based is a significant shift, and I think we can learn from those kind of things, right? From our perspective, how we have designed this program, and we are, you know, at TAIBU, we have developed what we call the model of Black health and well-being that has 3 main goals or pillars, which is about prevention, it's about restoration, and it's about advancement. So we are using this model even when we are designing and implementing this crisis response. The prevention aspect is number 1. It's a very kind of a uphill journey we have started, because when people are thinking about community crisis or a crisis call, I believe what comes to mind is police and 911. So that could deter people from seeking services in such situations. So we are committed to going into the community and promoting and sharing this new service so that people are aware that there is a service that is community-based, and when people go out, they can see themselves in people responding, people with lived experience, people with outreach experience, people with addictions experience, that can address them as people who are, you know, experiencing some challenges, but they're still people, you know, they're not criminals as such. So we have that component of an outreach component. We have a crisis team that goes out when there is a call, you know, through 211, and we go and respond, de-escalate situation. But that does not stop there, because when police respond to crisis, it's the immediate situation. Maybe it's taking people to the hospital, and that's end there. We have a post-crisis component of our program, which is part of the restoration advancement, and making sure people are going to be connected to services, to support, to whatever they feel like, if it's, you know, even if it's a spiritual service connection, mental health connection, housing connection, that we are able to do that. So people don't rely on the system of revolving through a crisis to get services. It's very early. We're seeing some very good responses from community that, you know, when they are calling for support, police is not the one responding. So it you know, it is not elevating their distress situation. It's people who look like them that go in, speak to them, de-escalate the situation, identify what the problem is, and making sure that they're connected. So the idea that, you know, and this could be applied to many of the other programs and services that we do. And I usually use the analogy of this, the cliff analogy. You know, the first time I heard it from Dr. Kamara Jones from the United States, it stayed with me, and I think it's the best way of describing how services have been systematically provided before. You have a cliff where a lot of people are falling down the cliff, and we have more Black people falling down the cliff, whether it's chronic disease, mental health, criminal justice, you know, education, you name it. If you use that analogy, we have people falling down the cliff, and the focus is always at the bottom of the cliff to pick up people with an ambulance, for example, and to take them to the hospital or to the morgue. And every time there's more people falling down the cliff, we invest in more ambulances because we need more ambulances to take people to whatever it is. So an example is when we have had community safety issues, community violence, the response from government, from the province or from the city would be, oh, we need more police. So we need more funding to the police. Knowing that the root causes of those situations are not safety related, right? They're more upstream. They're more about, services, resources being made available to communities, whether it's parenting support, housing support, food security, income support, employment, education. That's where the investment should be. And I think that is the model that we should be thinking about when we're talking about police services or any kind of systemic response is, yes, we need some immediate urgent attention to what is happening at the bottom of the cliff, but the problem is really high up there. And how can we build a barrier or a fence to stop people from falling down the cliff? If it is chronic disease, what do we need to provide for communities? And I think earlier on there was a mention about, is it lifestyle modification? Is it, social determinants of health? Is it toxic stress that we need to address? The package has to feel balanced, where we have the support first and the services afterwards. I mean, another example I could pose here is similar to policing, is school administration or disciplinary measures in schools. We see time and again classic examples of when there are some situations with white students, for example, the response would be more of a support nature, saying, what's happening? Are there any issues that you are facing? Do you need any support? But it's a similar behavior or a similar situation with Black students would be regarded as defiant behavior, this thug behavior, which is very, based on prejudice and stereotyping. And instead of providing support, it's more of a disciplinary measure that is being provided. So I think we need to try to kind of shift this way of approaching the problems that we face, whether it's challenges in communities, youth engagement, employment, education, mental health. We have to start thinking this, not us, because we know what's happening. Research, like people like Akwatu and Dexter have been saying this all along. Community programs know that this is this, but the system needs to start thinking differently, including how police is part of the system, and how policing should be regarded, whether it is by resourcing them, by finding different ways for them to engage with communities, and responding to health services, particularly mental health services. We're hoping with this 3 years pilot that the city has put in, that we can, it's been demonstrated in other jurisdictions like the United States and Europe, but I think it gives us a good opportunity here in Canada to demonstrate that there are alternative ways of addressing mental health issues, mental health crisis, support for communities that the system should start thinking about.
Yeah, and I wanted to jump in on that, Liben. This whole notion that you're articulating so beautifully about detasking police in terms of assigning to police functions that they are better suited for and removing away functions like mental health calls, substance use, homelessness, detasking police. When I've spoken to police officers in Canada and elsewhere, they've said, listen, we don't want to respond to these calls. We are not trained to do that. You can't respond to a mental health issue with a gun or a taser or handcuffs. You really need trained social workers, community workers to intervene in these situations. So police themselves are not wanting to do this work. And it becomes a way, again, of policing mental health, policing homelessness, policing substance abuse, which doesn't work. Felicia, you raised a question, and Liben also touched on it about data. And Akwatu also talked about it as well, that in Canada, we have spotty data at best, right? And even in the presence of data, some of these things are not changing. So what would it take? Data in itself is helpful, but it's not a magic wand. Even in the presence of danger, some of these systems still remain. So what would it take to actually move the dial on some of these systems? And I think, for me, this is my personal bias. Until we start seeing that we are all connected, that we all pay the price when there are social inequalities in society, that it affects all Canadians, both directly and indirectly, we would not start having a different conversation. So we know again from population data that when you have larger gaps of social inequality among groups, the overall population health is diminished by several years. And I think until people start making the connection that we are all connected, we are all each other's brothers and sisters, right? Look at COVID. COVID has taught us, listen, that we're all connected. If you don't deal with lack of access to healthcare, you don't deal with communities that have been left behind with COVID, and the structural issues that created those left behind communities. When pandemics hit, we are all impacted by that. And from an economic standpoint, there's this notion of gross domestic product, that the more inequality you have in society, it decreases your overall gross domestic product. It makes your community, your society less competitive on a global stage. We have to see reasons why people should care. And I think it comes back to this. Why should people care who are non-Black? Why should they care about the issue of over-policing in Black communities? Why are individuals whose communities are not impacted by COVID, why should they care about a low-income community that is disproportionately impacted by COVID, or whatever the social issue is? And until we start making that connection or realizing that we're all connected and all pay the price for inequality, then we would not have different systems, and we would not have different types of conversations that would lead to different types of systems.
Thank you for that. Also, just as a quick note to the audience to feel free to put in some questions in the Q&A. We'll be starting with that in some time. But Dexter, you brought up a great point around making sure that people care and therefore are going to want to do action. I have a follow-up question for you or other folks in the panel. How do we bring folks into the conversation to start to care and to start to be engaged in this work? Folks who are here attending this are probably already engaged and already really interested in supporting Black communities, addressing over-policing, et cetera. But for us, we sit at tables where folks are not engaged. They get fearful by the word defund. It sounds very daunting to them. So how do we bring more folks into the conversation and so that we can meaningfully address this going forward? Liben, I saw you unmuted yourself.
No, I was going to give Dexter the floor first.
I wanted to say that, I'm a fan of detasking the police, which is very different than defunding. So I just wanted to be clear about that, which may not necessarily mean that you defund the police, but you fuel resources to them to do community responses that they're better trained for, which is very different, detasking versus defunding. I think, again, when George Floyd, when his brutal murder was seen on television and rebroadcast, hundreds and hundreds of times, I can tell you that, folks that I interacted with in Black communities were not only personally devastated and traumatized by this, in addition to all the compounded trauma that people have been talking about and experiencing. But many of my white colleagues also reached out as well and was also distressed and traumatized by that, actually seeing another life snuffed out in front of your eyes by another individual. So and that caused a sense of moral confusion, it caused a sense of guilt, it caused a sense of shame, right? We are all impacted by this trauma and racial inequality in different ways. Let's think about the Clark and Clark doll studies, which was done in the 1960s in the United States. And basically, for our viewers who are not familiar with it, they ask a series of small children which doll they preferred, white doll or Black doll. And they asked that of both Black kids and white kids. And overwhelmingly, the white kids preferred the white doll. overwhelmingly, the Black kids also preferred the white doll. When they asked, who is the good doll? Who is the bad doll? Actually seeing a 4-year-old Black child looking at that doll that represented themselves and saying, that is the Black doll, the bad doll, and then putting their head down in shame, right? But that study really sort of brought to the fore that both white individuals as well as Black children are also negatively impacted by discrimination. And for white kids, it caused a sense of moral confusion and shame, right? So very often we focus on the victims of racial segregation, of the victims of over-policing. But our white colleagues know that their experience of the police is different, and very often that causes a sense of moral confusion and shame, right? Or what we call white guilt. So this whole notion, we are all impacted by social inequalities. When you have groups that are bearing a higher disease burden, that's a higher drain on the federal coffers, the federal dollars, healthcare dollars that could be going into prevention, that could be going into education, that could be going into other areas. And we all suffer to some degree the burden of that. So until we realize that we are all each other's keeper and we are all connected, and this is not a Black problem, this is a Canadian problem, right? We would not start having different conversations. And I hope we don't wait until another George Floyd moment or another pandemic, right? To come to the foreground to realize that, hey, we are all connected. We are all connected and we are all impacted by this. And it's not only the morally right thing to do to address inequality, but it's also the smart economic thing to do. And from a gross domestic economic standpoint, it's also the smart economic thing to do to address social inequality. Would we get rid of it in a capitalist society? Probably not, but I think we could diminish some of the huge gaps. Why is it that Black men in general have a lifespan almost 10 years shorter than their white male counterparts? When we look at talent being lost, what we call Einsteins, or the promising Einsteins, we have Einsteins in many different communities that are not being nurtured, not being brought to the foreground, not being able to achieve their full potential that can benefit society and the greater good of all because of social inequality.
No, I appreciate you bringing up some of those different perspectives, especially thinking in a capitalist society. Following George Floyd's murder, there were some arguments that the only reason that there was such mass attention given is because there was nothing else to look to. We were all inside, it was a pandemic, there was no distraction. For me, myself, as a Black individual, and for folks in my circles, that was really disheartening to think that it was only in a time like this that folks started to pay attention. So I want to let Liben and Akwatu jump in if they have anything else in terms of solutions for how do you bring folks into the conversation who haven't already been involved and engaged meaningfully?
Yes, so I think this is the $64 million question. It's also an overwhelming question because I think when you think about it and you don't see any possibilities, it can be overwhelming. I think what Dexter mentioned around this should be everybody's problem, and it's a moral obligation. It's also about human rights. It's also, we can think of also about economic benefits out there. And my kind of fear is that, and I think we're seeing it a little bit now, is that this reaction, whether it was out of guilt or discomfort after George Floyd, is kind of fading because right at the time there was a lot of engagement, a lot of statement, people were really talking about. I think it has had an impact now. People are comfortable to talk about anti-Black racism. I think that's a plus. But would it be with the same kind of compassion, commitment and moving forward, I think that's where we need to grasp this moment to continue this conversation. Because as I remember one indigenous elder say at a conference that we did not colonize and oppress ourselves. It is the white dominant society. It is the system, and so it is the system that needs to change, right? We are ready to help the system to change, but the system needs to be willing, and so that's how. Where do we get that alignment? I think continuing to build this allyship and solidarity, awareness, education, engagement, continuing to make possibilities for our white counterparts to have this uncomfortable conversation, I think would be something that we need to continue to do and seize this moment where they have been open to this conversation, willing to participate. I mean, in my experience of about 20 or 30 years in community work, I've never seen such a very short moment of how much money has been invested in Black communities. Significant. And particularly from sectors that have never even cared about giving out money to Black communities, corporations and stuff like that. So I think that is a good opportunity and learning to seize and continue to work with. In our experiences, when people have contacted us to say, we want to give you, this amount of money, we're saying, thank you for the money. We want a relationship, a long-term relationship with you, because the money would be used in a year or so, but the relationship, whether they can provide access to, I don't know, youth apprenticeship or bringing their skills and knowledge to community, that is what we need to do, I think. The second, I think also what we have started doing here at TAIBU is also thinking about systems change. Because we are seeing most of the funding we receive is very short-term project, kind of like 2 years, if you're lucky, 3 years. By the time you have a good project going, the funding ends. You have to go and look for other programs. And even when you are doing your programs, you're only impacting a number, let's say we're talking about supporting Black youth with academic mentorship and support, or addressing expulsion and suspension in schools. If you do the program out here, you will be helping a few number of people. But if the school system does not change, you will always be looking for money to do the programs to help a few number of people. So we have started designing programs so that we're thinking about systems change. So we're involving the schools. So the schools system also needs to change slowly through interaction, through demonstrations, through becoming a broker between families and the system and making sure that there is some way of navigating the challenges that they're facing. And when schools are seeing, oh, okay, this seems to be working, maybe this is also, we're all selfish by nature. We have to see something that is going to benefit us before we think about others and benefiting us. So that's why I think it's overwhelming. It is possible. I think it is still possible. I agree with Dexter. There's a lot of work to be done. There's a lot of engagement to be done, a lot of conversation. We're also doing a lot of work with board education around anti-Black racism. And when we have very uncomfortable but open conversation and people look at various data, even within their own organization, and say, our neighborhood is, this is what the neighborhood represents, but we're not serving any of the neighborhoods. What's happening? Do we need to change? Those small conversations, those small changes, those small policy statements, those small acknowledgement and recognition will help. It's going to be a very long journey. It will feel overwhelming most of the time, but if we can't keep positive and look at change, I think it's going to be a very significant challenge. Akwatu.
I'm glad I'm not the only person who feels overwhelmed. Akwatu, jump in. Feel free to let us know how.
Dexter wanted to follow up on that point quickly.
Yeah, I just wanted to put a little bit of a silver lining on this and follow up with what Liben said in terms of, change is very slow, but when you look at these systems that have been in place for more than 400 years, right? Systems that have excluded Black individuals. I think we have to also stop and pause and celebrate around some of the significant change that has taken place since George Floyd. So Liben, you talked about the amount of funding that increased to Black agencies and so on. And let me just put a plug here for the University of Toronto. In 2019, they had one Black dean. In 2022, they've now had hired like 5 Black deans and 2 vice provosts, vice presidents at the university, first time in the history. And I think that's also an exemplar in terms of how some corporations have also risen to the moment in terms of people who've always been qualified, who've never been given the opportunity, have been given the opportunity. Does more need to take place? Absolutely, a lot more. But I think we also need to pause and celebrate when change has taken place. At the University of Toronto right now, they have the highest number of Black faculty they've ever had, right, in the history of the school, in history of the university. So I think we need to look at ways in which Black folks have been afforded an opportunity that and doors have been opened that has been historically shut. Just this afternoon, I was having a conversation with an 84-year-old alumna, social work alumna, and she was telling me in the 1960s, she was working as a social worker in child protection, and she removed these kids from their home. And when the kids were in the backseat of the car, like kids, they were sort of exploring, and they went into her pocketbook. And for the first time, they saw a mirror. A mirror. These were young kids, 3 and 4 years old, and they were fascinated by the mirror because they had never seen a reflection of themselves before that day, which is astounding. Imagine going through the world and not seeing a reflection of what you look like. And in many ways, this is what has happened to many Black Canadians. They have lived in a society where they have not seen reflections of themselves as a CEO, as a dean, as a vice president, as a doctor, right? And if you cannot see yourself, you don't know what you can become. And I think with George Floyd, there was this sort of racial awakening that Black folks were not only systemically excluded, but they were being treated very differently and in a hostile way by these systems of care and systems of policing. And that has cracked the door just a little bit for opportunities for folks where opportunities have been way too long denied. So, as we talk about this, all the work that has to be done, I want us to stop and celebrate and acknowledge some of the change that has taken place, which is important for us to be energized and empowered and encouraged to continue to do the work.
And I fully agree with that. All that's been said, actually. I just wanted to add, a few points, sort of related to some of the questions that came up and then went. I think we're all responsible as taxpayers or residents of whatever city we live in where we face this phenomenon, because we are either at the receiving end or as beneficiaries or targets. And what we know now, following the whole George Floyd movement and the books about anti-racism that have flourished, the idea of you could be anti-racist, or if you're not anti-racist, you support the status quo effectively, and you sustain racism. So we all have a part to play in deconstructing both anti-Black racism as well as white supremacy, because they're two sides of the same coin. And the point I'd like to make is that not only are we all responsible as taxpayers, we're all at the receiving end of the stigmas and the racial anxieties that come with it, which is why it's so hard to change behavior. You can actually change assumptions, but changing behavior is something else. And implicit bias training in terms of police, there's a study, NYPD study, which reported in 2020 that, wow, lots of changes in assumptions and attitudes, no change in behaviors. It's very hard to change behaviors. They were still having the same disparities in use of force, in arrests, and profiling when they took action. But when they wrote down their, their tests or what have you, more positive attitudes towards racial diversity. So, I don't want to throw the baby with the bathwater. If you can change assumptions and attitudes, that's great. Then we have to worry about behaviors. So we know now that we can change assumptions and attitudes. What we don't know is how to change behaviors. And I think, there's very practical steps that can be taken to institute police accountability for behaviors that haven't been tried. And each jurisdiction, whether it's a municipality or a state, will probably have its own way. But I know that here in Ontario, we need to give resources to the OIPRD and the SIU, the investigatory bodies, so that they have the capacity to investigate these incidents. They should also be able to lay disciplinary charges when they find cause to do that, as opposed to turning it back to the police so that it looks as though we have independent mechanisms, when in fact, it doesn't end that way. It starts off that way, it looks that way, but it doesn't end that way. So there's ways to sort of address the accountability issues in the short term to mitigate some of the risk of being a Black person in these societies. But I think ultimately it's about power, not military power, you know, we talk in living in the age of war, but power through community control of policing. And what's the role of the citizen, the role of the resident, whether they have resources or they don't have resources, whether they're homeless or they have a home, in shaping the policy agenda and the practices of policing. And I think that many members of our community have been marginalized and feel marginalized. And policing actually enhances their marginalization by disempowering them and circumscribing their options and their alternatives, thinking that I'm here and this is all I do. I think there's a relationship between racialized policing and gun violence, or racialized gun violence. And it is true, the ideas, the assumptions that are shared by all. Black on Black crime, Black on Black violence, these assumptions are shared by all. It effectively means there's no victims. That's what Black on Black violence, that's why I don't use that term, but that's what I explain it to be. It means that when you hear about Black on Black violence, you can disconnect because there are no victims. When in fact, we have the largest proportion of victims, but no empathy for the victims. And you know, unless we can deconstruct gun gangs and drugs, which would be a benefit for all, because gun gangs and drugs or Black on Black violence hides reality. It masks reality. It's actually propaganda and propagandistic. And the woman who proved that for me is a white woman named Sarah Thompson at Ryerson University, who did a study on Black homicide victimization from 1988 to 2004. And 2004 was the year before the year of the gun, 2005. And in 2004, we had newspapers saying 70% of the homicides are Black, you know, that guns, gangs, and drugs, it's intrinsic to Jamaican culture and all that kind of stuff. And she did the most extensive study, coroner's reports, newspaper reports, interviewing people involved. And what she found, only 15% of the homicides, the gun violence homicides, involved illicit or criminal activity. 85% unrelated, 85%. Imagine that. And we have a community that when we experience gun violence, we also say, as many in the non-Black community say, what's wrong with our youth? What's wrong with them? Why can't they carry gun? What's wrong with the society that's producing the youth? What's wrong with all of us? What's wrong with the adults that's producing the youth? What's wrong with the society that's producing this policing? So that's why I think but that's a long-term question. Deconstructing race so as to reconstruct our common humanity is a long-term project. So we gotta look back, because you need to look back because we have been the object of dehumanizing propaganda for 400 years, which leaves many to question their own humanity and not even knowing where their humanity begins. So therefore, we absolutely have to look back, even though I don't want to look back, because the future ahead may be not that long, because we have to change how we relate to other human beings so that we can save the planet. And I can tell you right now, white supremacy and anti-Black racism is not just expressed internally or domestically, it's expressed internationally and globally. Thus it is that we can't even deal with global vaccine equity issues around COVID. We don't even see the humanity of the Africans who are slaughtered every day in Ethiopia or Congo or Yemen. Why? Anti-Black racism. We have to solve that in order to solve some of our global challenges as well. And that would be my last. I'm jumping off the hobby horse right now.
That's okay. Thank you for that. So I'm starting to see some of the QA questions are coming in. So I'm going to start asking some of the questions that the audience has been giving to us Feel free to keep sending them in. But a question to all the panelists, to what degree is poverty an intervening variable in many of the stats cited on arrests and over-policing? To what degree is this a problem of classism rather than racism? And to what degree is there an intersectional impact? For anyone who wants to jump in.
So quick response. Poverty is very much racialized in the United States, and arguably in Canada, poverty is also highly racialized, particularly in cities like Toronto. So it's hard to disentangle poverty, race, and outcomes because it's very much intertwined. And, you know, again, it goes back to a sort of caste system, right? And all societies have caste systems. And based on where Black identified folks fall in the caste system, you look at earning potential. So Blacks earn anywhere like 65 cents on the dollar compared to their white counterparts in Canada. So it's hard to disentangle poverty, income, generational wealth without an attention to race.
Yeah, and I would only add that, so racism acts through poverty, which is a social determinant, it acts through employment, which is a determinant, acts through education, but it also acts independent of them. So you have the poverty, and the poverty is amplified because you're Black, but then you also have to deal with the prestige issues around the status of the group that you belong to, which is stigmatized, which is perceived as low. It's almost like the Roma in Romania or the Roma in Ukraine. These groups are stigmatized as either out of the social structure or at the bottom of the social structure. So even if you make advances in income or employment or what have you, that social stigma still separates and amplifies some negative aspects of your condition and makes you vulnerable to disrespectful policing.
Thank you for that. I have the next question. It's directed to you, Dexter, but folks can also jump in. What are your thoughts on Black police who are serving, but yet also are subject to being over-policed themselves as a Black person?
Well, Black folks over-police, but keep in mind when we look at over-policing, this doesn't, of Black individuals, it just doesn't happen from white individuals. It also happens at the hands of also Black police, right? So it goes back to this notion in terms of internalized racism that Akwatu was talking about. Not only do racialized individuals also hold negative stereotypes of racialized individuals as well as themselves, right? And it's impossible not to think about from birth, you're inundated with messages in the media, in history books, representation, lack of representation, biased representations of yourself, literature, science, church. I mean, all around, this message is just coming at you 24/7 in very subliminal ways. It's hard not to internalize that. It's like asking someone to go out into the rain without a raincoat and try not to get wet, right? So when you look at George Floyd, Officer Chauvin struck the deadly blow in terms of crushing his windpipe, but you also had racialized officers who were part of that call, part of that detail, that also aided and abetted that murder scene, right? So yes, so I think, you know, again, what happens to a Black police officer when they're out of uniform and not viewed as a police in terms of their street clothes, that has a certain type of dimension. But to also keep in mind that the over-policing of Black bodies and brown bodies doesn't only happen, it happens across the board by both white as well as non-white officers.
Does anyone else want to jump in before I move on to the next question? Next question, how do our Western perspectives on mental health, including the DSM definitions of illnesses, impact Black communities?
I saw Akwatu jump when it says DSMV.
No, you could go first. Go first.
You go ahead. You go ahead.
Ask me again, please.
So the question is, how do our Western perspectives on mental health, including the DSM definitions of illnesses, impact Black communities?
Well, it's because the Western definition of health is really, of mental health is very individualistic. And like you were talking about anxieties or depression, which are high, not because of just individualistic experiences, but collective experiences. The interventions that are required aren't just individual type interventions, but collective interventions. And also the spiritual component doesn't get the degree of attention that it needs to for people from Black and African cultures, for whom spirituality is the first line of response to a mental health problem. And so people go to their spiritual advisors, whether it's a Muslim, an imam, or a priest, or what have you, because the first assessment of a mental health problem is often a spiritual concern. What have I done, or what do I need to do to atone, or what have you? And there's a greater role of spirituality in the response to many mental health problems among Black people than non-Black people for that reason. But I actually think it might turn out to be similar for all groups once we find a way of incorporating spirituality into treatment in a significant way, not treating it just as an appendage of treatment, but as a core aspect of treatment, as you need to when you're dealing with Caribbean groups, for whom it's the first, you got to actually incorporate that into your response. So that's number two. And number three is, we have a different set of historical baggage that hasn't been dealt with, that needs to be understood and unpacked. Coming out of slavery, the enslaved, and even slavery is too broad a term, although some people now are talking about post-traumatic slavery disorder, because the slavery experience was very diverse actually, and it influenced some of the conditions in the different Caribbean islands or places in South America, for instance. But slavery is one thing, but the slave trauma of that Atlantic Ocean trip is another. And then the trauma of the plantation and the discipline of the plantation, which has expressed itself and continues to express itself in our attitude towards discipline and licks, where we don't even realize that our parenting styles have been harmed by slavery, and that our understanding of disobedience itself is not an African understanding or understanding that's rooted in our culture and our cultural identity. It's something that has been harmed by that slave experience. And that's what no other group has to disentangle in order to move forward, because a lot of issues which affect our parenting and the way we deal with our children and our adolescents when they're acting out or have conduct disorders or what have you, aren't even culturally appropriate or as culturally appropriate as we think, because they're not really grounded in positive African culture. They're actually grounded in slave experiences, where corporal punishment and licks is the first response to acting out or not listening. And then I talk about know your place. And in the Caribbean, we have a lot of focus on being in your place, know your place. That's not our cultural identity, but it has a significant role in contemporary culture. And in order for us to deconstruct that, our researchers have to pay a lot of attention. We might have to have an DSM-6 alternative book. But that's how it is. Yeah. We have that slavery, post-slavery, but let me give you an example. We have a very hard time in the Caribbean attracting people to trades, to apprenticeships. Most people don't even know why. The word apprenticeship isn't like a saleable term. You don't get people excited and enthusiastic about apprenticeship. I actually believe one of the reasons why we have sort of a historic antipathy towards apprenticeship is because after slavery, we were locked into 4- and 5-year apprenticeships. you had an apprenticeship in the Black experience mean forced labor, free labor, 80 hours a week unpaid. After 80 hours, you could work for yourself, but you had to work 80 hours for those plantation owners for free as a coming out of slavery. And so the apprenticeship idea has a negative barrier, negative burden that people have to be aware of, and because we actually need to be able to foster and promote trades. You know, you can make a good living off of trades, but we have stigma towards it, and part of that stigma goes back to that experience of apprenticeships.
So let me respond really quickly to that question as well. As you know, many of the folks on the call know, the DSM-5 is a manual for the assessment and diagnosis of mental disorders and does not include information or guidelines for treatment or any disorder. Keep in mind that the DSM-5, like all the other versions of the DSM, will really based on white Eurocentric models and white male Eurocentric models, right? And like any assessment tool, it's not bias-free or value-free. So it comes with a lot of hidden biases or assumptions, basically views the world through the lens of white males. And it's also a tool that has been used in the past to subjugate women. So lots of sort of conditions that would deem female-oriented, natural conditions were deemed as disorders. Likewise, it was also used to subjugate or stigmatize individuals who are non-heterosexual, right, in terms of identity disorders, and also to hospitalize individuals as well. So keep in mind, again, it's a flawed tool. It's a form of communication around individuals and mental health, but many folks would argue that it is not culturally relevant. There are several populations that are excluded from it in terms of seeing the world or even the presentation of mental distress symptoms through a white lens. So again, it's flawed. It's a communication tool, but there are certain assumptions that are inherent in it that are very much based on white Eurocentric male ideals.
Liben, would you like to jump in before I move on to the next question?
No, but I think, you know, efforts and programs and models of addressing mental health for racialized communities, such as the culturally adapted CBT program, for example, or even introducing, you know, culturally affirming practices during counseling or support that incorporates, you know, the spirituality of the clients, if they wish to do that, and allowing them to explore that with a counselor or a therapy in situations like when we have culturally appropriate programs and services. That's very important. I mean, the program, SAPAC program, also incorporates these you know, values and principles into who is part of the program, what does the program, you know, how does assessments, you know, are undertaken, and what kind of service do we provide. So it's very, very critical that, you know, you can have a counseling service that may be Eurocentric in its approach, but by making it culturally affirming and appropriate to the clients, if you have the right model, the right staff to be able to do that, I think that makes a huge you know, difference, and at least bridges the gap. Sorry, Akwatu, you wanted to say something.
Yeah, I just want to add very quickly, because Dexter reminded me, you know, therapeutic goals vary considerably, and culture matters for therapeutic goals. So recovery goals, what are the recovery goals of the person with the mental health problem, substance abuse disorder, what have you? And one of the big surprises is when working with people who have what we classically call schizophrenia of some different cultures, they don't want to eliminate the voices, which is a surprise to many therapists. They actually just want to manage the voices. They don't want the voices when they're going to work. They don't want the voices when they're deep in sleep, so they can't get a good night's sleep. They want the voices when they can interpret the voices according to their belief system and do something with it. And is that openness, that cultural openness, that matters greatly, because you know, the effectiveness of all therapies is like between 40 and 50% anyway. So, you know, we need much more, and the cultural adaptation process that Liben referred to strengthens the available therapies, but we need therapies that are culturally rooted and grounded to speak to the diversity of cultures around the world that we have, and so that people can see themselves in their therapy. You don't just see yourself in the mirror, you see yourself in your therapy. This is for me, this is gonna work because it's me.
And the rate of inter-rater reliability, which means that if you have a client and you put them in front of 4 or 5 different mental health providers and they use the DSM-5 to diagnose the client, the level of consistency around that diagnosis is very poor. So someone presenting with the same set of symptoms would get a very different diagnosis across those 5 therapists. So the accuracy of using it to diagnose is not very good. And in some cultures, someone with schizophrenia, in Western cultures, that person is often seen as medicated, needing medication. And particularly if you're male schizophrenic versus female schizophrenic, Black and presenting with schizophrenic symptoms versus white, the level of treatment and response is very different. And in some cultures, as Akwatu talked about, those individuals are actually seen as shamans. They're actually seen as special, right? They're deified. They're not seen as being abnormal. They're seen as being very special, right? And these are not areas that are accounted for, or there are any allowances for that based on the sort of Western application of the DSM-5.
Thank you, everyone. Another question just came in. One person asks, we heard about some government mandates to collect race-based data in education, social service, and criminal justice sectors. Is this something that is happening in healthcare as well? So we saw that this was happening in pockets with the COVID-19 pandemic, but we're looking for something long-term. As people involved in healthcare, what are some ways to push our institutions on collecting race-based demographic data? And I would add, what are some ways to push folks to also use the data and not just collect it?
Yeah, I mean, definitely. I think, you know, there has been a lot of push to have race-based social demographic data, particularly, you know, with the COVID situation. There has been a lot of advocacy to make sure that there was race-based data collection to identify the extent of the disproportionality for different communities. And we've seen that, and also seen how that has helped to strategize and focus some of the resources, targets, and around racialized population, indigenous and Black population. Yes, it's very important that race-based data collection. I know at the Anti-Racism Directorate, when Akwatu was there's a standard that has been developed there. I think there are other principles. We also know that Black health leaders have worked around a framework of collection of data that, you know, that has some control and, you know, who controls the data and who tells the story. Those kind of frameworks are there. It's very important. And in addition for the data to be used for planning and services, the other kind, I think, focus that we also need to pay attention to is that we also need to use the race-based data collection as a means of creating an accountability system for institutions, government, policymakers, right? You know, a great leader in the Black health sector, Angela Robertson, usually, you know, says, you know, the United States has been collecting race-based data forever. They have very good race-based data collection. They have very good race-based data reporting and analysis, but nothing has changed as it relates to the disparity. So I think it's good that we have to start somewhere, and we need to start with the race-based data collection as it's growing up now, which is a good trend. And we have to use that for planning and decision making. but we also have to use it as a mechanism to create accountability for government, system, policymakers, and institutions.
Would anyone else want to jump in?
Yeah, I agree absolutely. And you know, people always forget that it's actually race equity data, and it's very clear that the legislation and the data standards that data is only supposed to be collected for an equity purpose. If you're collecting race-based data and you're not doing anything with it, you're not supposed to collect it. But that last piece is left out because what we've had so far for the past 2 years is data collection, no public reporting, no one knows what's actually going on with the data. So there was obviously a flaw in the analysis of how to get this data being used in real time. And that's actually what COVID taught us. COVID taught us that race-based data or race equity data is important for signaling the scope and size of a problem and being used as a benchmark to solve a problem, but it has to be done in real time. It can't be done 5 years after the fact because the problem is gone and then it's academic purposes only. And that's not the goal of the data. And why that's very important from a definitional point of view is that we don't want to reify, and there's a big word from where I come from, reify, R-E-I-F-Y, race. Because when you use race, people think you're agreeing that race is a biological construct or a biological reality when it isn't. It's a socially constructed experience, which is important in the complexity that needs to go into race data analysis. One of the problems of race data collection is self-identification. I identify as Black, but that doesn't mean my experience will be fully Black. My experience depends upon how many of my peers in society perceive me as Black and what they do in the way that they treat me. And that has to be factored in. And again, like I said, only for use, not for academic purposes, not to write papers, used to reduce disparities, disproportionalities, and inequities. Because we don't want to give sustenance to a bogus idea, which is this idea of race, when we're all Africans anyway. And that's another question for another day.
Well, and I think along that lines too, it's important, as Akwatu is talking about, that we don't problematize race, right? And there's a way we could collect race-based data, and then that data be used to script a very colonial narrative among those groups, right? So in terms of, okay, Black folks have higher rates of diabetes. This group has higher rates of cancer. And without the proper context or linking that data to other types of smart data, then it just leaves us with a problem or viewing these groups as a problem. We need to link this data to housing data, to looking at where people are living. We need to also ask other important questions related to that data in terms of exposure to trauma, exposure to neighborhood violence, access to fresh foods. We need to contextualize that data, look at policies, look at location, so that we don't just problematize race, right? Race-based data void of context can be very dangerous. And we know in scientific communities has been used in the past to amplify a narrative around Black individuals not being fully human, not being fully intelligent, right? Not having the sort of moral aptitude or motivation. So we have to be very careful when we collect race-based data, that we are making sure that we are not just seeing race as an outcome, but looking at what race represents in terms of location, place, access, trauma, policing, all these other areas that are associated with race.
Thank you. I'm going to have space for just one or two more questions. So if folks could maybe just keep their answers brief so we can squeeze in a couple more. But for the next question we have, can you all speak about policing in hospitals or clinical contexts that happens for Black communities, i.e. the use of restraints/sedations, forced discharge, etc.? And what are some ways we can approach solutions around this issue?
Very good question. And, you know, the disparities follow and persist across sectors, from school discipline to the use of restraints in psychiatric facilities. And I'm sure in child welfare situations, contexts. And so the way I worked on it in India, in Gujarat, India, which is kind of quite far, but still demonstrably positive, was, and this was use of restraints for people with mental health problems and, you know, overuse. So what we did was we had a human rights education program for everyone. We educated, and we did a cluster randomized control trial. We had 9 facilities, and 6 received the intervention and 3 didn't. And we used the 3 to see if there was any changes in recovery. So we educated everyone in human rights. We educated clients, providers, community members, police, everybody around a psychiatric facility in human rights. And we did a human rights scan of the facility, and we improved the facility when, you know, they were blatant, what you would call disrespectful amenities, physical amenities. And that human rights education, as particularly destigmatizing education, that, you know, that certain behaviors, certain acting out aren't actually the problems that we expect them to be, or as dangerous as we perceive them to be, and they're all manageable. And, you know, we had that anti-stigma education as well. And not only did it reduce sort of some of these behaviors and some of these negative practices, it improved recovery. So that's my own experience. That's why I believe education is meaningful, and training is meaningful, and contact is meaningful. But I also think organizational policy and accountability is like 50% of the change. You know, you gotta hold people accountable for the human rights and the human rights behaviors that are appropriate.
Thank you for that. Any other final contributions before we wrap up, Liben or Dexter?
Well, I just want to thank all of you for the invitation. And, you know, as we talk about all the work that still needs to be done, it's important to stop and celebrate the changes that have taken place. And, you know, change is slow, but I think it as Martin Luther King says, the moral arc bends towards justice. And again, hopefully we see ourselves as interconnected. And I think if we see our fellow and our common humanity, that is a step in the right direction.
Thank you for that. Anything from you, Liben? Final thoughts?
No, thank you. I think it was, even for me, for me particularly has been a very I was taking notes, so I've kind of, learned quite a lot. I'm hoping that it has been as engaging for our audience this afternoon. And we need to have this kind of conversation on an ongoing basis as a community, definitely, because this work around addressing anti-Black racism, as we were talking earlier on, requires a lot of engagement, awareness, education, conversation, coming together as a community. So thank you for organizing this event and for the invitation as well.
Yeah, likewise. Thank you for the opportunity and the stimulation and the exchange. It was very good. I just want to say that, we're talking about policing and police, but policing and police are a reflection of the society. And we touched on child welfare, which is related to who sees the police, who gets in trouble, who gets involved with the criminal justice system, the education system, where racialized children in general, but Black children and Indigenous children in particular, fall into that school to prison pipeline, which involve the police, and even on the streets, where the police feel they have the right and the need to intervene in the lives of racialized youth and individuals who leave those interactions feeling that they've been treated unfairly. You know, one of the things I didn't get into too much is the perception of unfairness, which really matters for trusting institutions in our society. And only 24%, and actually 18% now. In 1994, Scott Watley did a survey of Blacks, whites, and Chinese Torontonians. Back then, 76% of Blacks didn't believe that Blacks were treated poorly by the police. More than between 50 and 60% of Chinese and whites also believed that Blacks were treated poorly by the police. And he did a study in 2007, he did it again in 2019, and it has grown to 82% of Blacks. So only 18% of the Black population believe that they are treated fairly, compared to 70-something% of whites and Asians who believe they're treated fairly, a complete reverse. And that perception of being treated unfairly is a real problem for society. I think it influences your perception of institutions more broadly, health institutions, where we found that a major part of the problem of so-called vaccine hesitancy was actually vaccine mistrust. Black people didn't trust health institutions. Many of them hadn't even had so many negative experiences with health institutions, but they had negative experiences more broadly. So those negative experiences not only cost the lives and health and morbidity of people of African descent, it costs the society. And it's a cost that we have to reduce as we move forward. And it's also a cost that influences how we interact globally with others. Because it's not only that we have this inextricable fate nationally and locally, we also have an inextricable fate with people in Africa, the Caribbean, Latin America, South Asia. We're all going up or we're all going down. And it's health, it's wealth, it's humanity, you know, and I'm inspired by the conversation.
Thank you everyone for attending. Thank you all for attending this very special Dalla School Public Health event. We hope you learned a lot. I hope you all took notes like Liben did. And if anything, there will be a recording on the YouTube channel. And I hope you take these both into your professional and personal spaces. Please be sure to take our quick post survey, which is in the chat, and let us know what other topics you would like to hear from. And thank you again, everyone. I hope you have a wonderful evening.